Dear friends, in this video let me explain you the flow of study. How, where, when, how many years, everything in detail I'll let you know. Number one, once you get into the Bay University, you have to be there in the Aruba Island for first 3 years. I make it very clear. The 1 year will be pre-medical course. The second year and third years, they are pre-clinical course. Because you will not be entitled to go into the hospitals. Even in India, it's like that. For the first 1.5 years, they have to go on, be in the class. Only in the third year, they'll be allowed to go to see the patients and go to the hospitals. It is everywhere. Universally, it is like that. Likewise, first 3 years, you have to be in the Aruba Island. After the completion of the third year, you have to write the part 1 part of USMLE. Since this 3 years, each and every day, you are going to be trained only in USMLE syllabus. You will not find it very difficult to get through the exam. Easily you can go through. For which, what are the things we have done? In our own colleges, in our own country, you know everything. You have got only 3 exams. One is first time exam, second time exam, then final exam. This is how we read. But in Aruba Island, particularly in Bay University, what we have done is you have to write an exam, very serious exam. On all Saturdays, I make it very clear. The end of the year, what are the total congregation, what are the things, the marks you have got, that mark will be awarded to you. So, no moving here and there, number one. Number two, usually in medical colleges, we used to have 100 to 150 students in one class. Imagine, 100 students in staircases type, everybody will be there. The teacher will come, he will never bother whether you are listening to that or you are sleeping, whatever you are doing, they will never bother. They come, take classes for 30 minutes, they will keep walking out. To avoid that one, my brother and myself, because for 100 students, if you have one teacher, your expenditure will be very little. But we never bother to work it in that way. So we have seen only 20 students per class. So for 100 students, I have to appoint minimum 5 doctors, class teachers. So it will be very expensive. But in spite of that, we are doing it for the betterment and benefit of the students who are coming and joining in the Bay University. That I make it very clear. So first 2-3 weeks, we start the things. If we find some student, they are weak in that some subject, we will not ask you any of the extra money, but we take it as it. We, on our own behalf of our Bay University, will give them training or tuition at the end of the classes. So actually this tuition, why we give it? We have to make them to get through USMLE Part 1. So this is the first phase. Second phase, after passing the USMLE Part 1, you will be entering into the US, in Florida, somewhere else. In America, there is one type of system is prevailing. In India, if I want to start a medical college, automatically I will have an hospital. Everybody knows it. You take any medical college, it will be attached with an hospital. The hospital, whether you get patients or not, nobody bothers. You kindly think certain medical colleges which you would have started in and around your area, new colleges, you go and see how many OPs they get. Only limited. This is a problem. But in America, just like that, they never accept any of the private medical colleges at all. How big you are, no problem. In one area, in one city, they have given accreditation certificate to a particular hospital to act as an institutions to take up or to educate children. So learning institutions are recognized by the US government. So our Bay University, we have got a tie-up with those kind of hospitals in US. So after completing this third year, you will be going and placing in that ACGME accredited hospital, which is recognized by the government of US, nowhere else. So there you will be completing for 2 years clinical studies. You will be seeing cases and clinical rotations will be there in all departments. Everything will be given a nice and a beautiful training program. After completing that one, you will be awarded MD degree. To award after getting the MD degree, you will be eligible to write the USMLE Part 2. You take it from me, at the end of the 5th year in medical colleges, you write a final exam. You treat it as that one. So as a final examination, USMLE Part 2. Once you complete this one, once the final examination in MBBS get through, what we do? We get ourselves admitted in the house agency for a period of 1 year. Likewise, after completing this USMLE Part 2, you will be given a senior internship. It is not a job or a salary, it is a stipend. You take it from me. That is, you can do that for 5 years. This is a time given by the government. But most of the Indian people, they complete the USMLE Part 3 within the stipulated time, particularly within 9 months to 1 year, 1.5 years, everybody will write and get through. The reason being is basically our Indian kids are too much intelligent. And USMLE, you take it from me, USMLE Part 1 is very toughest, but Part 2 and Part 3 is not like that. So on completing USMLE Part 3, you will become eligible, you will become a MBBS doctor here. After completing the house science, you become an MBBS doctor, full-fledged. Likewise, you become a full-fledged MD doctor. If I want to get into the government, say what I should do after completing MBBS, I cannot go for the government job. I have to undergo the Tamil Nadu TNPSC, Public Service Commission exam. I have to go. Then only I will be given a posting in the government side. In India, everybody knows it. Likewise, in US, they got a board. This board will give you an exam. After completing that, within 21 days, it is written in the Google. Go and check it up. Within 21 days, automatically, you will be given a posting in any of the 50 states in US. The payment, kindly go and check in the Google for cardiologists and orthopedicians in US is right on today. It is not less than $500,000 per year. What is it, $500,000? Indian money, you multiply that, it comes to 3.75 crore, nearly 375 lakhs. So that is the reason, repeatedly I am telling you, 1 day 1 lakh you earn. You got 365 days, you got 375 lakhs. So per day you will be earning more than 1 lakh. You take it from me. No sir, we don't want this America and also we don't want to work there. And with the green card, that also I underline. With the green card you will be going and serving there. Your whole generation will be transformed. You take it from me. But sir, we don't want. Let me come back to India. Okay, pretty much you can come back to India, write one small exam, finish. You are considered as MD. Unlike already I told you from other countries, if we come, it is considered only as the MBBS. But here, because this is given by the American board certification, automatically it is considered as MD universally, globally. This is what repeatedly I am explaining you. This is how you read and you finish your course in our Bay University. Okay, next slide, let me give you some more details. Thank you.